Hi everyone, I'm Dr. Naresh from the MEDESUN. Welcome to the e-learning. Today's our topic is CABG and how to code CABG, CPT codes. So as you can see here, CABG is Coronary Artery Bypass Grafting procedures. It is a procedure, medical necessity is a coronary artery disease. Whenever there is a blocks in the coronary arteries, when you can see here, there is a less circulation, ischemia to this area, so due to a blockage in this artery. So whenever there is other services like less invasive procedures are not done, they will go with the open heart surgery for the grafting. So here they used the two grafts, one is artery and one is the vein. So there are entirely two CABG procedure, coronary artery bypass. They are bypassing this blocked area, so to retain the blood circulation to this myocardium. So whenever myocardium of the heart is getting the enough blood now, then the circulation is good now, then there is no issue. So whenever there is a block, heart will not function normally. So to resolve this issue, they are selecting the CABG procedure. Here, as you observed, one is the vein graft, one is the artery graft. Two grafts are used for the two CABG procedures. This vein or this graft can be taken from the other parts of the body. And coming to the guidelines for reporting the CABG procedures, we have two codes. One is for grafting, for bypass grafting, and one is for the harvesting. So main procedure here is the grafting. So first we need to report the bypass grafting code, and next harvesting codes also. So step one, report the bypass grafting codes as a primary, and next report harvesting, taking the vein or artery vessels for grafting purpose. So never report harvesting codes as primary. First, purpose is grafting, so we need to report the bypass grafting as a primary. Here we have some codes, but you need to remember from the CPT, we don't have a saphenous vein harvesting codes that is included in grafting. So no need to report the saphenous vein harvesting. Other veins, yes, we can report. If they took the artery for grafting, don't report. If it is upper extremity artery or a radial artery, then you can report it. We'll go with the examples, then we can find. So these are the code sets for the CABG procedure. If the artery grafting is done now, CABG procedure by arteries, these are the codes: one artery graft, two artery grafts, three artery graft, CABG procedures. And there is another code set, vein grafts only. So only veins are used for CABG procedure. One vein used, two veins used for two CABGs, three veins used for the three CABG. We have a separate codes, and there are another set of codes for the CABG procedures for grafting for vein grafts whenever combined with artery grafts. So as we can see in the image also, here one vein graft is used, which is in blue color, and one artery graft used. Whenever a procedure happen like this combinedly, artery graft and vein graft harvested and grafting is done, to report vein grafts we have a separate set of codes. So we can go with the one artery graft 33533, and there is a one vein graft. Now don't give 33510 because it's a vein graft along with artery graft. Now to report vein graft we have a code 33517, one vein graft. Primary code you need to give one artery graft, which is 33533, and along with harvesting, which artery is taken or which vein is taken. Based on that we need to report the harvest codes. So we'll go with the examples. Here, CABG with artery. So one CABG procedure done with artery, and what is that artery? Left internal mammary artery. And as per the guideline, we have a code for upper extremity or radial artery harvesting only. So we are reporting only grafting code, CABG code, not for the harvesting as it is a mammary artery. And you can see here guideline only the harvesting of upper extremity. So we reported only grafting code. Next scenario, CABG with artery. So one artery graft by radial artery. So now we reported two codes. First code is for the grafting. One artery grafting code is 33533. And next scenario, next is what for harvesting. Why we given harvesting? Because it's a radial artery, which is a upper extremity artery. So that's why we given a harvesting code also as a add-on code, additional procedure. Next, third scenario, CABG is done with veins. So here two veins are harvested, and what are those two veins? Two are 7s veins only. So here they did two CABG procedures with two veins, and that are two 7s veins harvesting. So everything is in vein only. Both are two veins only. So how to code these? Only vein grafts are used now. Then we have these code sets. So two vein graft CABG code is 33511. So we given that code for two vein CABG only. Next code for the harvesting, no need to code because there's these are vein grafts. So for reporting the Cephalus vein harvesting, we don't have any codes and it is included. So that's why we don't report. So we end up with only grafting codes for two veins only. Next scenario. Here CABG procedures done combinedly, nothing but two CABG procedures done, and one is the artery harvested and one is the vein harvested. And artery is a radial artery, so we can report, and vein is a saphenous vein, we don't report. First we will give the grafting. As it is combined now, for artery grafting, 33533, one artery graft, 33533, and next to vein graft now we need to have give these codes. So whenever vein graft combined with artery graft now, to report vein graft we have these codes. So one vein graft is combined with artery now, we have a code 33517. So this code is two CABG procedures grafting codes given. For harvesting radial artery we can report, so we given 35600, but Cephalus vein harvesting is included. It's bundled. We should not report it, so we didn't given any harvesting code for the Cephalus vein. So you need to remember these criterias. Guidelines are how many grafts are used, whether are artery grafts used or vein grafts only used or combinedly used. Not to report vein grafts, we have separate set of codes. And coming to the harvest codes, if it is the artery is harvested, report only upper extremity artery harvesting. If his vein is harvested, now you can report any vein but not saphenous vein. By following these rules now, you can report CABG procedures correctly. Thank you everyone.